This policy brief is about the Healthy Hunger-Free Kids Act of 2010 and how it relates to the Messina Regional School District's local wellness policy. I'm Carolyn Cormier, and I'll be walking you through the policy brief. This policy brief analyzes the Obama administration's Healthy Hunger-Free Kids Act, or HHFKA, of 2010, which attempts to mitigate both rising obesity rates and childhood hunger, both of which have been steadily rising over the past 3 decades. The brief discusses the Healthy Hunger-Free Kids Act as well as the wellness policy of the Messina Regional School District. It's an example of how one local school district implements the requirements of the federal law. HHFKA was signed into law by President Obama in 2010, and it sets up guidelines for the USDA's nutritional programs. It sets requirements for school wellness policies, as well as for school breakfast and lunch programs. The discussion is timely in light of the prevalence of obesity in America's children and teens, which has been increasing substantially. It's up roughly from 8% in 1980 to 13% in 2013. School wellness and nutrition policies help combat this by providing parents and children with nutritional information and healthy food and lifestyle choices for students during the school day. This chart outlines the Healthy Hunger-Free Kids Act and shows how it encompasses several components of different wellness initiatives in our country. The act was first advocated for by the First Lady's Let's Move initiative, and as you can see, it includes reorganization of several pre-existing entities. It includes the National School Breakfast and Lunch Program, the Summer and After School Food Service Program, Nutrition Program for Women and Children, also the Child and Adult Food Care Program. This policy brief focuses on HHFKA in regard to the National School Breakfast and Lunch Program and the school district wellness policies, which are here in the chart. Bardock recommends an 8-fold process for policy analysis, which begins with defining the problem and assembling evidence. Schools are taking an increasingly large role in health and nutrition of children in America. Many students often receive both breakfast and lunch at school, and many of these children, which is 17 million in the nation, are actually considered part of food insecure households, so they're also battling hunger issues. On top of that, 1 of every 3 American children are considered overweight or obese. As far as criteria, under the legislation of HHFKA, all schools that participate in the National School Lunch Program and have federally assisted meal programs for students are required to follow the law and develop an internal wellness policy. The policy has to include training for food service staff, has to have nutritional guidelines for meals that are served in schools. It has to have goals for physical activity, as well as nutrition education in any health classes. The Messina Regional School District's wellness policy has all of these components and requires that food offered to students follow federal guidelines. It requires, in addition, that holiday parties and even student birthday parties, which are really common in the district's elementary schools, follow that policy as well. The policy states that faculty and staff can't use food or drink as reward for academic or behavior performance, and also that adults in the school should set a positive example for health and wellness in their own food choices. As far as projecting outcomes, there are both positive and negative outcomes to HHFKA. However, positive outcomes seem to outnumber the negative outcomes. Positive outcomes include improved overall health, the potential thwarting of preventable disease, and also the promoting of lifelong health habits. Negative outcomes that were brainstormed include the increased cost to families. So under the law, federal funding of school lunches does increase, but it does require that schools gradually pass on that increased cost to families. Positive aspects of health and wellness promotion in schools seem to largely outweigh any negative aspects. The Messina School District does get some complaints from families about the loss of tradition and bringing somewhat unhealthy foods to school to celebrate birthdays and holidays, but the potential benefit and heightened awareness of health and wellness seem to outweigh these negatives. In addition, the Healthy Hunger-Free Kids Act has received much positive feedback from national organizations, including the American Medical Association, the American Heart Association, and the Academy of Pediatrics, to name a few. It is the responsibility of local school districts to create and implement district-wide wellness policies and meet the regulations of HHFKA. The federal government did include stakeholders in the process of creating the policy and accepting their comments, and is now up to local school districts to conform and comply with the policy. The Messina Regional School District does this through a wellness committee that is tasked with evaluating the components of their district health initiatives. They take feedback from students, feedback from parents, and compile all that together and provide it to policymakers on an annual basis. HHFKA proves to be a positive and effective policy. This is evidenced by very strong participation rates. Over 90% of schools were participating after just 1 year of this law being in effect. And this is really evidence of the policy's acceptance and its overall effectiveness. This policy brief has found both the Healthy Hunger-Free Kids Act of 2010 and the Messina School District's wellness policy to be viable, productive policies that contribute to the overall wellness of American students and families. It will be important for recommendations, however, that both the federal government and school district leaders monitor their policies on a regular basis to ensure that they're successful. Leaders need to plan comprehensive evaluation plans that allow for evaluators to make recommendations to policymakers so that they can make adjustments when necessary to their wellness policies. This will ensure that policies remain living documents and that they actively contribute to the goals of the federal policy as designed.